So many of my patients come to me and they say, "Hey, Dr. Wagner, my grandma had heart disease. My mom has diabetes. Am I at risk?" And this is an important question because if your family members have certain diseases like cancer or heart disease, it can make you wonder about your own risk of developing those same conditions. But before we get into that, let's start with a brief history lesson. Let's dive in. Before we get started, please take a moment to subscribe and hit the bell icon. If you find this video helpful, please share it with others. And be sure to follow us on social media for more health tips. Type 1 diabetes is an autoimmune disease where your body mistakenly attacks the insulin-producing cells in your pancreas. Cancer is a disease where abnormal cells divide and grow out of control, forming tumors that can damage organs and spread to other parts of the body. Dementia is a term used to describe a decline in mental ability that is severe enough to interfere with daily life. Liver disease refers to any condition that causes damage to the liver, which is an organ responsible for removing toxins from the blood, producing proteins for blood clotting, and helping with digestion. Mental disorders are conditions that affect a person's thinking, feeling, and behavior. By understanding your family's health history and making positive lifestyle changes, you can reduce your risk of developing these conditions. And don't forget to subscribe and hit the bell icon to get notified when I post new videos. Have a wonderful day. Bye-bye. Just remember, just because you have a family history of a certain condition doesn't mean you will definitely develop it. It just means you may be at higher risk. So take proactive steps to protect your health and consult with your doctor about your risk factors and preventive measures. Your future self will thank you. Examples of mental disorders include depression, bipolar disorder, and schizophrenia. And these conditions can be caused by a variety of factors, including genetics, brain chemistry, and life experiences. In fact, studies have shown that some mental disorders can run in families. For example, if a parent has major depressive disorder, their child has up to a 3-fold increased risk of developing the same condition. Fortunately, there are effective treatments available for many mental disorders, including psychotherapy and medication. So if you have a family history of mental disorders, talk to your doctor about ways to manage your risk and seek professional help if needed. The most common types of liver disease are alcoholic liver disease, non-alcoholic fatty liver disease, and hepatitis. And these conditions can be caused by a variety of factors, including alcohol abuse, obesity, and viral infections. In fact, if you have a family member who has liver disease, your risk of developing the same condition can go up by 2 to 3 times. Now, there are things you can do to reduce your risk of liver disease, like avoiding alcohol, maintaining a healthy weight, and getting vaccinated against viral hepatitis. Alzheimer's disease is the most common cause of dementia, accounting for 60 to 80% of cases. And although dementia is not directly inherited, some people are at increased risk due to family history. Studies have found that a person's risk of developing Alzheimer's disease doubles if they have a close relative with the disease. Other risk factors for Alzheimer's disease include age, genetics, and lifestyle factors such as lack of physical activity and social isolation. Now, there are things you can do to reduce your risk of developing dementia, like staying mentally active, engaging in social activities, and maintaining a healthy lifestyle. There are over 100 different types of cancers, each with its own risk factors and warning signs. Some cancers are more common in people who have a family history of the disease. For example, breast cancer, colon cancer, and prostate cancer. In fact, if you have a close relative, like a parent or sibling, who has had cancer, your risk of developing the same type of cancer can go up by 2 to 3 times. Fortunately, there are things you can do to lower your risk of cancer, like eating a healthy diet, staying physically active, and avoiding tobacco. And if you are at high risk for cancer, talk to your doctor about ways to prevent it. I actually made a whole video about how to prevent cancer, so check it out after this one. Type 2 diabetes is a disease where your body becomes resistant to insulin, leading to high blood sugar levels. And the risk factors for diabetes include obesity, physical inactivity, and a family history of diabetes. In fact, if you have a parent or sibling with diabetes, your risk of developing type 2 diabetes increases by 2 to 3 times. But there are things you can do to lower your risk of developing diabetes. And I've actually listed some of them down below. So check them out after this video. Your body is basically just a bunch of cells, right? We're all just kind of bags of cells. Inside those cells are your genes, the things that make you you. These gene variants can sometimes be harmful and raise your risk of developing certain health conditions. For example, certain genetic variants increase your risk of breast cancer. Other genetic variants increase the risk of getting type 2 diabetes. And other genetic variants can increase the risk of getting heart disease. And sometimes you can inherit more than one variant, which means your risk goes up even higher. So understanding your family's health history can help you figure out if you've inherited some of these risky variants. This knowledge can help you take steps to prevent or manage certain health conditions. They determine your eye color, how tall you might grow, and also increase your risk of certain health conditions. Those genes are located inside structures in the cells called chromosomes, which are bundled up pieces of DNA. This includes coronary artery disease, also known as CAD, peripheral artery disease, which is known as PAD, and cerebrovascular disease. Now, what does all this mean? Well, think of your arteries as roads for your blood, the smoothie that keeps your body running. Smoothies are pretty good for you. Okay, good source of vitamins. Coronary artery disease happens when the arteries that supply blood to your heart muscle get clogged or damaged. This can lead to chest pain, heart attacks, or even death. Peripheral artery disease happens when the arteries that supply blood to your arms and legs get clogged or damaged. And this can cause pain when you walk, sores that won't heal, and even loss of limbs. Now, cerebrovascular disease happens when the arteries that supply blood to your brain get clogged or damaged, which can result in things like stroke or dementia. And the risk factors for cardiovascular disease include high blood pressure, high cholesterol, smoking, and diabetes. And if you have a family history of cardiovascular disease, you should see your doctor about ways to lower your risk factors and keep your heart healthy. In fact, I made a whole video about heart attacks and how to prevent them. So check that out after this one. You inherit half of your chromosomes from your mother and the other half from your father. Now, sometimes when we pass down these chromosomes to our kids, mistakes happen. It's really common for there to be little typos in these genes. In fact, I'm going to now share with you 6 conditions that you need to look out for in your family tree. Okay, so the first condition that you want to watch out for is any type of cardiovascular disease. The second condition to watch out for is diabetes. Diabetes is a condition where your body struggles to regulate blood sugar. All right, the third condition to watch out for is cancer. Okay, number 4, Alzheimer's disease and other forms of dementia. Okay, no. 5, you want to watch out for liver disease. And finally, number 6, you want to watch out for mental disorders. Okay, so overall, having a family history of certain conditions can significantly impact your health risks. Speaking of thanking, I want to thank you for watching this video. I hope it was helpful. Please share it with others.